So, good day everyone. My name is Janpin G. Enriquez, Section 12F, Group 22, and a student nurse from Davao Doctors College. And today I'll be showing to you my return demonstration about newborn care. So, newborn care is defined as the management of neonate and of course the subsequent period of stabilization. So first is we'll wash hands and prepares the needed materials such as the cotton balls, the sterile gloves, the umbilical clamp, the bonnet, a forceps, syringe, measuring tape, the vitamin K, the Hepa B, the BCG, and of course the ophthalmic ointment. So preparing all the materials needed helps to save time and effort. So next is properly identifies infant through the name band or wrist tag. So this is to identify the infant's identity. So I have here baby Gonzalez. So enhances infant's comfort by keeping the environment warm. So this is to prevent heat loss that may result to hyperthermia. So we will just make the aircon warm. Okay. Next is wash hands before putting on working gloves. So this is to prevent the spread of microorganisms. So next is we will move on to the cord dressing. So this procedure helps us to prevent infection around the baby's cord stop. So first is we will put on the sterile gloves. Here, I have my sterile gloves. So after putting the sterile gloves, we'll properly restrain upper and lower extremities of the newborn. So this is to lessen the infant's body movements for easier access. So just like that. Then we will using OS with ROH disinfects cord 3 times from base upward. So this is to properly clean the cord and remove possible presence of microorganisms. So we will now clean the cord upward. Okay, so after that, place sterile OS at the base of the cord and clamp the cord with umbilical clip 1/2 inch from the baseline of the cord. So the clamp helps stop bleeding from the blood vessels in the umbilical cord. Like that. And so after that, we'll clamp and cut the cord using a plastic clamp about 2 cm from the base after pulsating stock within 1 to 3 minutes after birth to prevent anemia and intravascular bleeding. So I have here my clamp. So we will now cut the cord. So after that, cast the cord about 5 cm above the cord clip and expresses the remaining blood from the cord with the OS placed on the base of the cord. And the cord is no longer needed and it will be cut in order for the umbilicus to be closed and healed. Like that. Okay, so next is place OS at the base of the cord stump and pour 70% ROH over the cord. So this is to clean and decontaminate the base. So next is the vitamin K injection. So this is needed for the blood clotting to prevent a serious disease called hemorrhagic disease of the newborn. So first is we will withdraw the exact amount of vitamin K from the ampule and injects into the middle third lateral aspect of the infant's thigh. So vitamin K provides protection against bleeding that could occur because of low levels of these essential vitamins. So this is an improvised vitamin K. We'll get the exact amount. And then inject it at the thigh. Like that, and get the cotton. Okay. Then next is we will inject the hepatitis B. So hepatitis B vaccine about 0.5 ml of intramuscular. So assuming again this is the hepatitis B vaccine, we'll inject it at the okay, for that. Okay. Then now let's inject the BCG vaccine about 0.1 ml into the intradermal right deltoid. So assuming that this is the BCG vaccine, and the lateral aspect of the infant's thigh is preferred site for an intramuscular injection because it is the bulkiest part of the thigh. So after that, we will carefully get the anthropometric measurements of the newborn, starting with the head circumference, chest circumference, abdomen circumference, and the newborn's length. So the collection of these anthropometric measurements is particularly useful during the development and growth of individuals. So first is we'll measure the head circumference. Okay. So for the normal head circumference, it is 33 to 35 centimeter. For the normal chest circumference, it is 31 to 33 centimeter. For the abdomen circumference, it is 31 to 33 centimeter. And for getting the length, we will just turn the baby here. And for the normal length is about 46 to 54 centimeter. So next is we'll take the newborn's temperature rectally. So rectal temperature provides the best result of an infant's body temperature. So we'll just put it at the rectum of the baby until it will beat. Okay, so let's move on in initial bath. So it is the bathing of the baby. So we'll hold the newborn in a football grip manner, folding both ears. So this is to maintain the comfortable position of the baby and prevent the water from entering through the ears. So next is we'll carefully wash the newborn's head with the use of baby soap or mild shampoo and wipes dry thereafter. So the baby soap and the mild shampoo are preferred for babies because they are unlikely to cause irritation to baby skin. Just put some water. Get the mild shampoo. then rinse. So after that, put on the newborn's diaper, shirt, mittens, and booties. So diapers are given to absorb and hold the baby's waist, while the mittens and booties protect the baby's finger and toenails from the trauma and to prevent the baby from scratching his or her face. So next is we will now wrap the newborn securely with clean blanket. So places the newborn in the crib with drop light on and attaches crib tag. So the crib prevents infant falls while drop lights maintain the warmth of the environment. So as you can see now, we are wrapping the baby. Then we will put it at the crib. So we will assume that this is the crib here. And after that, we will put the name tag of the baby here at the top part of the crib. So next is we'll move on to the application of CRIDS prophylaxis. So shades newborn's eyes from the light and open one eye at a time by exerting gentle pressure on the upper and lower lids. So this is to protect the infant from eye infection or the ophthalmic neonate room. So just do like that. And after that, we will apply ophthalmic ointment from inner to outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So ophthalmic ointments are used to protect newborn babies against eye infection. So we must follow the principle of starting from an area furthest from you. So we will just imagine that this is the ophthalmic ointment. So we'll put it from inner to outer canthus. Inner to outer canthus. Then after that, we will take the newborn's vital sign. So vital signs are good indicator of newborn's adoption and survival, such as the temperature, heart rate, respiratory rate, and saturation. So we'll take the temperature, the heart rate for about 1 minute. First, we will take the temperature of the baby. Next is we will get the heart rate of the baby for 1 minute. So next is we'll do aftercare to maintain cleanliness. So moisture is a good environment for bacteria. Moisture is a good environment for bacterial growth. So we'll do the aftercare. And after doing it, we will remove our gloves. So next is we'll record the procedure done and other pertinent data. So this is for documentation purposes that the procedure was done and the means of communication among the professionals of the health system through the exchange of information that concerns the patient. So after that, we will do hand washing. So this is to prevent the spread of microorganisms. So we'll just record everything. Okay, and after that, we will answer related questions of the procedure. This is to provide information and awareness of possible outcomes of the procedure. So I am done now with my written demonstration, ma'am, and thank you for watching.